Let me ask you something very specific. Do you find yourself clearing your throat? Not once, not twice, but dozens of times before lunch? And when you do, it helps for maybe 30 seconds, then comes right back? Here is what I want you to notice. It is worse in the morning. It is worse when you first lie down at night. And no matter what you drink or eat, warm water, honey, lemon, it just keeps coming back. Now here is the part that surprises most people. In the majority of patients I see with this exact problem, the throat is not actually the source. Something else, happening somewhere else in your body, is triggering that mucus. And most people, and honestly even many healthcare providers, never identify it. Today, I'm going to show you exactly what that is. 4 specific research-backed causes, and a clear, practical plan you can start tonight. But I want to start with the one cause that is responsible for a very large proportion of persistent throat mucus cases in adults over 55. It has no obvious symptoms. It happens while you sleep, and there is a very good chance it is happening to you right now without you realizing it. Stay with me, because this is the part that changes everything. My name is Dr. Michael Adeyemi. I work in preventive health and senior wellness. And if you have ever been told it is just your age, learn to live with it. I want to offer you something very different today. A real explanation and real steps forward. Drop a comment right now and tell me, how long have you been dealing with this persistent throat mucus? I read every comment personally, and your answer helps me serve this community better. And if someone has ever dismissed this as just aging, add the word dismissed to your comment, because I want to know how many people that has happened to. Let us get into it. Section 1. What mucus actually is. Before we talk about causes, I want to reframe something. Because most people have the wrong idea about mucus itself, and that misunderstanding is part of why this problem never gets properly addressed. Mucus is not the enemy. Your body produces mucus continuously, every day, and it does so for excellent reasons. Mucus is your respiratory system's first line of defense. It traps dust, bacteria, viruses, and airborne particles before they can reach deeper into your airways and lungs. It keeps the delicate tissue lining your airways moist and protected. The problem is not the mucus. The problem begins when that normally thin, fluid, manageable mucus becomes thick, sticky, and slow-moving. When instead of being cleared naturally, it pools at the back of the throat and creates that persistent, uncomfortable sensation that sends you reaching for water dozens of times a day. Now here is something genuinely important that most older adults have never been told clearly. Research published in scientific literature has confirmed that mucociliary clearance, the body's natural system for sweeping mucus upward and out of the airways, measurably declines with age. The tiny hair-like structures lining your airways, called cilia, slow their beating frequency as we get older. Studies have shown that nasal mucus transit times increase significantly with age, meaning mucus that would have cleared quickly at 40 can linger and accumulate at 65 or 70. This means that any factor which triggers extra mucus production will have a more pronounced, more persistent effect in older adults specifically. Understanding that context is essential, because it explains why the 4 causes I'm about to describe matter so much more as we get older. Section 2, cause number 1, silent reflux, LPR. The first cause, and the one I want you to pay closest attention to, is something called laryngopharyngeal reflux. Most people have never heard that term, so let me explain it in plain language, because this single cause is one of the most consistently missed explanations for persistent throat mucus in older adults. You probably know what acid reflux is. The burning feeling in the chest after a heavy meal. That familiar heartburn. That is the well-known version. But there is a different, quieter version. One that does not come with chest burning. One that can go unidentified for months or years. And clinical research, including studies published in the NIH database, confirms it is a real medically recognized condition. It is called silent reflux, or laryngopharyngeal reflux, LPR for short. Here is what happens. There is a muscular valve at the bottom of your esophagus, the tube connecting your mouth to your stomach. This valve is designed to close tightly after you eat, keeping stomach acid where it belongs. But in some people, particularly as they age, this valve becomes less effective. Stomach acid does not just rise slightly into the lower esophagus. It travels all the way up to the throat, the voice box, and sometimes even higher. And here is the critical fact that research has established. The throat and vocal cords are far more sensitive to acid than the esophagus. Even tiny microscopic amounts of acid reaching the throat trigger significant irritation and inflammation. Your body's response? Produce extra mucus to coat and protect that irritated tissue. Completely logical, completely appropriate biology. But when the acid keeps reaching your throat, night after night while you are asleep and have no idea it is happening, the mucus production keeps getting triggered over and over. Now, here is the detail that makes this so consistently overlooked. According to research, up to 50% of people with laryngopharyngeal reflux report no heartburn at all, no chest burning, no obvious digestive discomfort, just chronic throat clearing, mild hoarseness, often worse in the morning, and that mucus that keeps coming back no matter what you do. Cleveland Clinic data notes that roughly 10% of adults are affected by LPR, and more than half of people who visit a throat specialist for chronic hoarseness are found to have it. This is why it gets missed. There are no obvious digestive red flags pointing toward the stomach. Just a throat problem that turns out to have a stomach cause. Think about this pattern honestly. Is your throat worse in the morning than during the rest of the day? Do you notice more throat clearing when you bend forward or lie down? Has your voice sounded rough or different when you first wake up? These patterns matter, and the practical steps to address them are not complicated. I will walk you through them in the action plan. One important note for anyone who takes anti-inflammatory pain medication, ibuprofen, naproxen, or similar, regularly for joint pain or arthritis. Research has shown that this class of medications is associated with worsening of gastroesophageal reflux symptoms. The mechanism involves the reduction of prostaglandins, substances that normally protect the stomach's mucosal lining, which can increase acid production and irritate the stomach lining, making reflux more likely to occur. If you take these medications regularly and your throat symptoms have been persistent, that connection is worth raising specifically with your doctor. Please, never stop any medication on your own. Always speak with your doctor first. But this is a conversation worth having. Section 3, Cause Number 2, Post-nasal drip from chronic sinus congestion. The second cause is one that many people are living with silently, because it does not always show up the way they expect. If you are new to my channel, kindly press that like button and subscribe to my channel. I will upload more videos about your health. When most people think of sinus problems, they imagine intense facial pressure, throbbing headaches, completely blocked breathing. And yes, that is one presentation. But in many adults over 55, chronic low-level sinus inflammation presents much more quietly than that. No dramatic headache. Breathing feels mostly fine, and yet the sinuses, mildly inflamed and producing slightly excess mucus, drain steadily and quietly down the back of the throat. This is called post-nasal drip, and a 2024 retrospective study of patients with chronic post-nasal drip found the mean patient age to be 55 years, confirming this is very much a concern for this age group. Throat discomfort was the most frequently reported associated symptom, appearing in nearly 74% of patients in that study. The pattern tends to look like this. You go to bed feeling relatively fine. While you sleep, gravity does its work. The mildly congested sinuses drain slowly downward into the back of the throat. By morning, there is a significant accumulation waiting. That thick, heavy feeling. That immediate urge to clear your throat before you can take your first sip of tea. Now, many people dealing with this have been buying antihistamine tablets from the pharmacy, assuming they have ongoing seasonal allergies. The problem is that antihistamines dry the mucus temporarily without addressing the underlying sinus inflammation. And dried, thickened mucus is often more uncomfortable and harder to move than the original problem. The approach with the strongest evidence behind it for post-nasal drip is regular nasal rinsing with a warm saline solution. The European position paper on rhinosinusitis, one of the most authoritative evidence summaries in this field, recommends daily saline nasal irrigation as a first-line adjunctive treatment with level 1A evidence, meaning it is supported by multiple well-conducted studies. A 2025 systematic review published in the journal Medicine confirmed that nasal irrigation is an effective, safe, and low-cost strategy for reducing nasal congestion and post-nasal drip symptoms. The key word is consistency. Occasional use gives occasional benefit. But daily practice, particularly in the morning, consistently produces meaningful improvement in people who apply it properly. Have you ever tried nasal rinsing? Tell me in the comments. If it helped you, or if you have never tried it, I want to know. Your experience could encourage someone watching right now to take a step they have been putting off. Section 4, Cause Number 3, Medication-related mucus. This third cause genuinely surprises people when I bring it up. Because when most patients think about what might be causing their throat mucus, their daily medications are simply not something they consider. But for many older adults, certain regularly prescribed medications can directly contribute to persistent throat symptoms. The most well-documented example in medical literature is a class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors. These medications are widely prescribed, effective, and generally very well tolerated. But they carry a recognized, class-wide side effect: a persistent dry, irritating throat sensation, and increased urge to clear the throat. The mechanism is medically established. ACE inhibitors work by allowing a substance called bradykinin to accumulate in the body. In susceptible individuals, this accumulation triggers an irritation response in the throat. And crucially, it is not an allergic reaction. It is a pharmacological effect of how the drug works. How common is this? Research published in the journal Chest and confirmed across multiple peer-reviewed studies reports that ACE inhibitor-induced cough and throat irritation occurs in approximately 5 to 20% of users. A large study of 27,492 patients found that adults over 65 had a 53% higher odds ratio of experiencing this side effect compared to younger users, making this particularly relevant for our audience specifically. Here is the timing detail that causes the connection to be missed so often. This side effect does not necessarily develop immediately. It can appear gradually, weeks or even months after starting the medication. So if someone began a blood pressure medication 6 months ago and their throat has been bothering them since, the two may feel completely unrelated, but they are often not. If you take a blood pressure medication and your persistent throat clearing began or significantly worsened around the time you started it, please mention this specifically to your prescribing doctor. There are alternative medication categories such as ARBs, angiotensin receptor blockers, that control blood pressure just as effectively, and research confirms they do not carry the same throat side effect. Again, never change or stop a prescribed medication on your own, but this is a conversation worth having, and it is one that could make a real difference. If you are still there, type number 4 in comments. Section 5. Cause. Before. Dehydration and environmental irritants. The fourth cause is actually two factors working together, and their combined impact on throat mucus is larger than either one alone. The first is inadequate hydration. This one sounds almost too simple, but the physiology is genuinely compelling. Think of your mucus like honey. Warm honey flows easily. Cold honey is thick and slow. The composition is identical. Only the hydration of the surrounding environment changes its behavior. Your mucus works in a very similar way. Well-hydrated mucus is thin, fluid, and easy to clear naturally. Dehydrated mucus is thick and sticky. It accumulates in the throat rather than moving through the system efficiently. Here is the issue that is specific to older adults. Research has well established that the thirst mechanism becomes less sensitive and less reliable as we age. You can be meaningfully dehydrated, enough to affect your mucus consistency and daily comfort, without feeling particularly thirsty. Waiting for thirst to prompt you to drink means you may consistently be operating in a state of mild dehydration without realizing it. A commonly used practical target, referenced across clinical nutrition guidance, is approximately 30 milliliters of fluid per kilogram of body weight per day from all sources, including water, herbal teas, soups, and water-rich fruits and vegetables. The important behavioral shift is to drink intentionally and consistently throughout the day, rather than waiting for thirst as your prompt. The second factor is environmental irritants in your daily surroundings. Dry, heated indoor air during winter months draws moisture from the mucosal lining of the throat and airways, causing them to compensate by producing thicker mucus. Wood smoke, strong cleaning product fumes, traffic pollution, heavily scented candles, and dry air conditioning all create low-level, ongoing irritation that keeps the mucus response chronically activated. These are not dramatic triggers. They are background factors, invisible, constant, and cumulative, and that is exactly why they are so often overlooked. Section 6. Warning signs that need a doctor. Before I give you the action plan, I want to take a clear and honest moment to talk about certain signs that go beyond typical mucus issues, signs that need proper medical evaluation, not self-management. Please speak with your doctor promptly if you notice. Mucus that is consistently tinged with blood, even a small amount. Unexplained weight loss occurring alongside persistent throat symptoms. Difficulty swallowing that is progressively worsening over time. A persistent lump or swelling in the neck. A significant voice change that is not improving. The vast majority of persistent throat mucus in older adults is benign and addressable, exactly what we are talking about today. But your body sometimes uses symptoms to signal something that needs professional attention. If any of these are present, please do not self-manage. Speak with your doctor. Section 7. The action plan. Let us bring everything together. Here is a clear, practical plan. Organized so you know exactly what to do and when. Tonight, before bed. Stop eating at least 3 hours before you go to sleep. When your stomach is still actively digesting and you lie down, gravity works against you, making it significantly easier for stomach contents to travel upward toward your throat. 3 hours of upright time after your last meal gives your body a meaningful advantage. Raise the head of your bed using a small firm wedge or folded blanket placed under the headboard legs, not just an extra pillow, which only bends your neck. Even a few centimeters of incline is enough to use gravity effectively and keep stomach contents where they belong overnight. This is a well-established behavioral recommendation for managing laryngopharyngeal reflux. Drink a full glass of warm water before bed. This supports overnight hydration and helps keep mucus thin. Tomorrow morning, begin your day with 1 to 2 glasses of plain warm water. Before coffee, before breakfast, before your morning medications. This single habit costs nothing, rehydrates your body after the overnight fast, and immediately begins to thin and loosen accumulated overnight mucus. It is consistently one of the most impactful morning changes people report making. This week, get a simple nasal rinsing device, a neti pot or squeeze-style bottle, from your pharmacy. Use water that has been boiled and cooled to a comfortable warm temperature, not straight tap water, which in many areas contains trace microorganisms that are harmless when swallowed, but should not be introduced directly into the nasal passages. Add a small pinch of salt, and optionally, a very small pinch of bicarbonate of soda, which may help thin mucus further by neutralizing nasal acidity. Use this once daily, ideally in the morning, and give it at least 2 weeks of consistent practice. The European position paper on rhinosinusitis recommends this type of high-volume saline irrigation as a first-line adjunct. It is safe, evidence-based, and low-cost. Make an appointment with your doctor to review your current medication list specifically in relation to your throat symptoms. If you take a blood pressure medication, ask whether it is an ACE inhibitor and whether an alternative exists. Come prepared with the timeline of when your throat symptoms started and whether that timing aligns with any medication changes. Commit to staying consistently hydrated throughout the day. Set reminders if it helps. Keep water easily accessible wherever you spend most of your time. Do not wait for thirst. A quick word on popular remedies. Honey has genuine soothing properties for irritated throat tissue. It is not harmful and can calm symptoms temporarily, but it does not address any of the underlying causes we have discussed today. Dairy does not create mucus from nothing. The science does not support that old claim. But in some individuals, dairy proteins can create a sensation of increased thickness in existing mucus. If you notice dairy consistently worsening your throat, a 2 to 3 week reduction experiment is worth trying. Sugar in warm drinks can actually draw moisture from throat tissue through a process called osmosis. So plain warm water or plain warm water with lemon without added sugar is a better choice. Here is what I want you to leave with today. That persistent mucus in your throat is not something you have to accept as a normal, unavoidable part of getting older. It is a signal. And now you have a research-grounded framework for understanding what that signal might mean. And a practical, step-by-step response to it. Silent reflux, happening silently while you sleep with no heartburn to warn you. Post-nasal drip from chronic low-level sinus congestion. Medication-related throat irritation from ACE inhibitors, now documented across thousands of patients in peer-reviewed studies. And the combined impact of inadequate hydration and environmental irritants working quietly in the background. None of these require you to accept a life of constant throat clearing. Each one has a practical, evidence-supported response, and none of them require a prescription. If you have been told it is just your age, I hope today gave you a very different perspective. Because you deserve more than a dismissal. You deserve an explanation, and I hope today delivered that. Make sure you are subscribed and have the notification bell on. You do not want to miss my upcoming videos. If this video gave you something of real value today, please share it with one person you care about who has been dealing with the same persistent throat clearing and has been told it is simply their age. That share costs nothing and could genuinely help them. And before you leave, drop your comment. How long has this been going on for you? What have you tried? Has anything helped? I read every single comment, and I am genuinely here for this conversation. Take care of yourself. I will see you in the next one.